Live on Your Health tonight, troubleshooting tummy aches in kids. Here with some advice is Dr. Kristen Moffat, an infectious disease specialist at Boston Children's Hospital. Good to see you, Doctor.
Hey, Dr. Moffat, it's great to see you. So, question one, we get a lot of questions from parents about this, and the questions range everywhere from, is it a virus? Is it food poisoning? Is it just my kid trying to avoid doing chores? 90% of the time it probably is. Of course, you treat a lot of patients with this symptom, so how do doctors decide if it is serious or not?
Yeah, it's a great question because just as you said, this is probably one of the most common symptoms that kids report. So parents and pediatricians grapple alike with this exact question. The overwhelming majority of stomach aches are nothing serious, and a child will recover from them with some rest and ideally some hydration and a little bit of time. The signs, though, that something might be more serious have to do most often with the severity of the stomach ache. If they are writhing in pain and can't seem to get comfortable even at rest, if when they get up and start walking, the pain is acutely worse, those are signs that something more serious could be going on. A lot of very mild cases of viral gastroenteritis can be combined with other symptoms in addition to stomach pain that could include fever and vomiting and diarrhea, and those may seem serious. I would say that if there is ever blood in a child's stools or blood in their vomit, they should be seen right away. But other than that, it's okay to approach the child with fever control and pain control and really, really close attention to hydration. And if they seem pretty comfortable, once those things have been addressed, it's unlikely to be anything too serious.
All right, so all good reminders. Let's talk about food poisoning. Do you typically see more cases in the summer months?
Yeah, you would think so, based on people just eating outdoors, more food being in the sun. Certainly, protein or dairy-containing products that are left out in the heat would increase the risk for food poisoning. We don't tend to see a very strong spike, though, but we do see food poisoning sort of all year long, and it's important to know that this can be avoided and prevented with very careful hand washing around preparing food and eating food, very careful washing of fruits and vegetables, especially if they're going to be eaten raw, making sure that proteins like meats and fish and eggs are cooked all the way through, and being very careful about storing leftovers.
And Dr. Moffat, many parents rely on the so-called BRAT diet, B-R-A-T, bananas, rice, applesauce, toast, to help the kids recover. Is that something you recommend?
I don't necessarily recommend the BRAT diet per se. I think it's important for parents to know that the most important thing, especially in the first couple days of a gastrointestinal illness, is attention to hydration. Parents always worry when their kids' appetite for solids drops, but most kids have some reserve, and they're going to be okay if they don't eat solids for a couple of days. Really focus on hydration, ideally with something that's got some sugar and some salt in it, because those are being lost through vomiting or through diarrhea. When they feel ready and are asking for some solids again, or if you're offering them something periodically, it's okay to offer them what you think it is that they'd be excited for. If that's a more complex carbohydrate, or if it's a fruit or a vegetable, that's okay too. And just offer it, engage their response to it, and you can sort of tailor that accordingly in terms of how they do.
As a Greek mother, my mother, and then I did it, we would give chicken broth. And
chicken broth is great.
Right?
Yep,
not the brat diet,
yep,
but
yep,
just boil a chicken.
Yeah, we got the
Put
chicken
the
soup.
onions in.
We got the same
get the broth,
thing.
Get the broth in
Chicken
here.
broth is great. It's got that salt in it.
Yeah.
It's
Yeah, no, it's
the
good.
sodium is in there too. All right.
Right.
Yep.
Thanks, Dr.